here's my starting point. My assumption is you know a lot about social marketing. You've been doing this for a while. You've learned a lot about it, some through schooling, some by doing. And you want to learn more. That's why you're here, to further advance your health promotion goals. Some of you focus on Mexican migrant populations, border health, and so forth. And so I'm trying to orchestrate my remarks to be most relevant to you given the population you work with and the kind of work you do. And just as a confession, I'm a recovered health educator. So I've been on the front lines for many years and shifted to marketing, which can encompass education, but from a different perspective. The goals for this next hour are, number one, for you to learn some new ideas, new ways of thinking that'll make your social marketing more effective, and I'll suggest some tools with which you can implement this way of thinking to fundamentally advance your mission. I hope you'll get excited about the idea. Our main idea is creating a value proposition, and I'll tell you exactly what I mean by that shortly. And third, that you'll apply this back at work. If you don't take it home with you, it's not going to do much good. So I'm going to try to make this as practical as possible. And fourth, that you share your results in an ongoing way with your colleagues here. So hopefully this meeting will help create an ongoing network and a sharing both here in the United States, in Mexico, and across the border. Here's my value proposition to you. You will emerge with some very powerful ideas and tools that can dramatically focus what you do and improve your marketing effectiveness. So I'm asking you in exchange to invest an hour, think hard, and have some fun doing it. So that's the proposition. I'm going to start with an overview of key principles. Then we'll start applying them right away, which is part of the introductory exercise. Then I'll provide some examples and case studies so you can learn more and practice creating your own value proposition. And then we'll end, if time allows, with putting it into action and a few minutes for questions and answers. There's also a handout which, rather than having every slide, has a summary of the one-page summary of the main points, and then a few tools behind it that we'll get to towards the end. Creating your value proposition. I do believe this is the essence, the real focus of what makes social marketing effective. Okay? So to provide context, it's important to start with the face of public health. Most of us work in public health. I also teach in the School of Public Health. I'm going to try to pull some of that into this here at San Diego State. And I'd go back. This is what I consider the main face of public health. No, there's not anything missing. This is it. What do I mean by that? It's invisible. Public health works best when it's invisible. And that powerfully affects what we do on the health promotion side if, when we're effective, people can't see what we do. So when public health is working, there's no disease breakouts, you're not sick, there's no STDs, and so on. And that's even more true for prevention. When prevention works, we don't see anything. So one of our challenges is to make prevention and make public health more salient, make it visible when, in practice, it's invisible at its best. So that's one of our challenges. So that's, as context, the face of public health that we work in. So what's a value proposition? A value proposition is the benefits you promise that make it worthwhile for people to do what you want them to do. So underneath this, there's a few key ideas. One is, what is social marketing? In my view, in my opinion, in a word, marketing is an exchange. Yes, there's programmatic aspects to it. There's the 4 Ps and so forth. But most fundamentally, marketing is an exchange. There's a give and there's a get. You give me $1, I give you a Coke. You give me participation in a program, I give you better health. That's the exchange. So the relevance, the value proposition is making apparent the value of the exchange. What's the give and what's the get? Second is, as a result of an exchange, there's the notion of real value and perceived value. And here's where we run into problems sometimes. We think, as health promotion people, as public health people, that what we do is inherently important. How can people not care? How can people not care about using condoms? How can people not care about eating better? When in practice, people's main concerns may be putting food on the table, having a house to live in, paying rent, and their HDL-LDL ratio or something else is far lower on the totem pole of priorities. So we need to think about value as we think about it, and then perceive value, what's important to the people we're trying to reach. So if we try to get in the minds and hearts of the migrant population, what are their lives about? What makes them unique? Coming to this side of the border, it's called coming to the other side. From this way, it's called crossing the border. There's something very different in terms of what direction people are going. So how do we understand what's in people's minds and hearts to understand their perceived values? Third is figuring out from the outside in what makes them tick. So the vehicle, the philosophical and conceptual vehicle for understanding their values, their perceived value, is looking from the outside in, putting ourselves in their shoes, not sympathy, but empathy, and saying, if I was in their shoes as them, what would my priorities be? Would I care about this health program? Would I care about needle exchange? And so on. So it's looking from the outside in. That's a critical principle. And what follows that is this notion of what I call wrong reason health promotion. How do we get people to do things from the wrong reason? That ties in directly to what they value, the benefits they care about. So we have a nutrition program. We ostensibly want people to come because they say, yes, I want to reduce my risk of morbidity and mortality. Well, few of us say that. What if someone wants to come to your nutrition program because they think they'll look better? Or they'll meet a partner, or their nails will get better, or their hair will be shinier? Is that acceptable? We may consider that the quote-unquote wrong reason, but if we follow the principle of putting our target audience in the center, a core social marketing principle, then those reasons are the right reasons. And we need to find a balance between things that motivate people, the value that they perceive as worthy, and the things that we care about. And that's what creates the exchange. So as a result of doing this kind of thing, we end up with a value proposition. The value proposition creates a niche in people's minds and hearts. So your program, your department, your organization has a place to live in people's minds and hearts. That's referred to as positioning, and it reflects your identity, your organizational soul, who you are, what makes you tick, why you're here. So let's try the value proposition idea. I'm doing this as an exercise. It's my belief that the best way to learn new ideas is to incorporate them on a personal level first and then professionally. So you're thinking, yes, we at the table get to play this game, tell our story, and share our value proposition. That's right. I wish there was time for everybody to do this, but to keep on track schedule-wise, we're going to limit it to the folks at the table, though I invite everyone not at the table to do this on your own as well. So what I'd like you to do is just briefly introduce yourself, and you'll have plenty of time to think of this, like 10, 15 seconds. So no pressure. And tell us your value proposition. What I mean by that is professionally what you do best that provides value to your organization. So that's the fundamental component of a value proposition. So an example, we did this for the Department of Health and Human Services recently here in San Diego with their mid-level and aspiring executives. And here's some of the value propositions that people put forth. One person said, well, what I'm good at, what I do best is I analyze data from different sources, from different places, and converge it and find patterns and then translate that into program priorities. That's really my contribution to my department and organization. Someone else said, I'm a people person. I'm out there in the community. I can motivate people. I network well and build support for our programs. I get people's buy-in and get them involved. Third person said, I do a lot of everything well. I do some administrative stuff, some budgeting stuff, some program development. He is what we called our Swiss Army knife person. Did a little of everything and did it all pretty well. So my question to you is, what do you do best that provides value to your organization? And a second reason for doing this is for you to get to know each other better. A result of doing this, hopefully, is you can tap into each other's skills and learn more about each other. So we'll start with
me?
with you, our first volunteer.
Okay, that's good. Hi, my name is Ljubica Latinovic. I'm a doctor from Mexican Ministry of Health. I am a health marketing and health communication coordinator. And well, what my value proposition would be is, okay, thank you. Should I?
Please, yeah, definitely.
Again, okay. Okay, so my value proposition is that I speak well, huh? Okay, again. So my name is Ljubica Latinovic. I'm a doctor from Mexican Ministry of Health, from Health Promotion Department. I am a coordinator for health marketing and health communication. And let's say my value proposition for today would be that I network best with the people I actually work, and I think that I can make a great team to work with me.
Excellent. Thank you.
Hello, Ignacio Romero, and I am in Sacramento. I work for the former Latino 5-A-Day, which is now created new logos and new taglines and all we're going to unveil here pretty soon. To give you a heads up, we have a couple of little things, the Champions in Change, which you'll probably start hearing. There's some colleagues from Ph.I. here. Also, just to answer your question, I think where I work best, or what I bring to the table, as I came into the State Departments here for Latino 5-A-Day, I thought that a lot of the networking background that I brought to the table in working with the binational committees and working around the state with different entities, community clinics, and public health agencies, just knowing how to kind of connect those two entities, I think it's one of the main keys. And you know, I like to offer a lot of my my knowledge of coming back with in mind of my parents and how they got connected to things like health and not only health but also events that happen in our communities, originally from Oxnard. So I understand a lot of the community piece, and that's what I think I offer to this podium.
Thank you.
Hello, I'm Francisco Montano from the San Diego-Tijuana Border Initiative, Deputy Director. And my value proposition is I'm a really fast reader, so I do all our background reading. And also, I'm able to do just about everything or a little bit of everything, so there are only a few of us, so it's good to be able to multitask and be able to pitch in where they need us.
Another Swiss Army knife. Thank you.
Hi, my name is Janine Barbado, and I'm the Chief of the Health Communications Unit within the California Department of Health Services Cancer Detection Program's Every Woman Counts program, which basically is a breast and cervical cancer screening social marketing campaign. And so my value really is to both internally communicate to our staff, both at our level and also above in the Office of Public Affairs, to try and continually to promote and to brand our message to the community, and also to externally communicate, try and develop messages, strategies to try and reach our population and the local community. We also need to collaborate. I try and collaborate as much as possible with other organizations such as American Cancer Society, Susan G. Komen Foundation, to try and work together to promote our program.
Good morning. My name is Claudia Erickson. I'm a health educator, and I work for the California Department of Health Services, the Infectious Disease Branch, and for the Veterinary Public Health section and the Vector-Borne Disease section. And I work primarily with West Nile virus surveillance and trying to put messages out there to the residents of California and what they need to do to try to reduce their risk of contracting West Nile virus. And what I bring in terms of my value proposition is I spent 11 and a half years working for a local county health department and working with very high risk groups of people And so coming up to a state level to work, I was able to bring those years of experience. I know you say you're a recovered health educator. I'm not recovered health educator. I believe in health education, but I believe you need to know your population. Coming up to work at the state level, I've been very fortunate in that I've had a chance to collaborate with local health departments all over the state, also with the mosquito and vector control associations throughout the state of California, and a little tiny bit with binational border health issues, which I think is what brought me down here today. The collaboration is important. To reach the migrant population in California is important. And I hope that, I really hope that through today too, that I will be able to take some things back to my local agencies, because this is why I'm there.
Excellent.
So thank you.
Thank you.
Hi, I'm Michele Rivero. I'm a health educator with the Childhood Lead Poisoning Prevention Branch, which is part of the California Department of Health Services. And so what I do there is basically help our branch to develop and distribute prevention messages to our county and for the state. And also some of what I do is I work with our local counties to evaluate their programs to help them make their outreach efforts more effective.
Hi, I'm Heather Gilardi, and I also work with the Childhood Lead Poisoning Prevention Branch. And I collaborate with local health jurisdictions to help parents understand how to best prevent lead poisoning for their children. And I'm also a registered dietitian, so I look at this from a nutritional standpoint in primary prevention, in that if parents feed their kids healthier foods, they'll most likely prevent lead poisoning.
Excellent. Thank you.
Hola, yo soy Sandra Martinez Lobatos. Estoy encargada dentro de los servicios estatales.
I am in charge of health state services in Baja, the coverage extension and health promotion programs. The strategies that we have is a proposal to have both health departments in Baja come together to do outreach. One for health promotion and another where we reach vulnerable groups, people outside the urban areas or people without health coverage and our migrant populations. And one of the tasks that we're implementing is taking this promotion not only to these places but also to extend coverage within the state and to not just have a health promotion in and of itself, but to have a holistic approach that involves everybody that works on health. Good morning, Laurencia Gurrola. I am a surgeon, and I've had the experience of working before in operations, working directly with the population in different programs within our Ministry of Health and with the migrants program in our state. And now, as health promotion coordinator, the great challenge and what I think is my value proposition for the programs that we have at the Ministry of Health is to achieve what the doctor was saying. One of our new strategies is to have a social platform of organized groups. Well, there are some groups that are already organized, but to work more closely together with them so that we can have health promotion both from the services and from the prevention aspects in public health. Hello again. My task at the Ministry of Health is to work at the Department of Health Services that deals with all of the prevention programs. That, in a nutshell, is it, all of them, including everything that my two colleagues mentioned before me. And in short, what I can share with you from my experience in working on all different levels, as Laurencia said, both in operations and now all the way to a position such as the one I hold now. Now, as far as my value proposition, which is what you requested, I would like to see to express, what it is that I feel I bring to the table with my colleagues. Very specifically, in my opinion, is honesty, my work responsibility, commitment with our users, quality or improving the quality of the services that we provide, and respect, not only for our colleagues, but also before the populations that we serve. Thank you.
Good morning. My name is Ian Rosengarten. I am a graduate of San Diego State University's Public Health School and have about 30 years in mental health experience in particular. After graduation, I actually worked as a healthcare marketing consultant for about 10 years, operating my own business. Most recently, I've been working for San Diego County Behavioral Health Services in the Mental Health Division in the Quality Improvement Department. I also have been the lead for the Latino Access to Mental Health Care project for the last 5 years. And I'd say the common thread that I've seen over time as far as the value that I want to offer is customer service. So that entails my being able to offer service to my internal customers, the people I work with, as well as all the external customers that I'm involved in. And that seems to work.
Hello again, I'm Shari McLaughlin. I work for the County of San Diego Health and Human Services Agency in the South region, and I do community health promotion. I obtained a master's of public health in health promotion, and I think my value to my agency and the community is I really serve as a liaison between the community and the agency. I provide technical assistance to community groups, help connect them to programs and services and resources and data that the agency has, and also inform the agency about the community needs. And one of the advantages of my position is I'm funded with flexible dollars, which most people in public health are usually in some sort of categorical program. So I can be the Swiss Army knife. I can, reorganize my priorities according to what the South region's needs are. Although I do spend half of my time focusing on childhood obesity prevention. But I work on serve on a wide variety of coalitions addressing different issues.
Good morning. I'm Fernando Stañudo. I'm with Vista Community Clinic, and we're located up in North County, San Diego. And I think the expertise that I'm able to bring at the table is about 20 years of program development and evaluation. I oversee about 45 different programs up in North County in the areas of HIV, tobacco prevention, reproductive health, farm worker health, and women's health. One of the areas that I think that I tend to specialize in is the migrant farm worker and migrant population. Vista Community Clinic and the University of California, Irvine were actually the first agency or one of the first agencies to actually implement an HIV prevention intervention for Latino farm workers that was followed for about a year. And for those of you that know the population, that's pretty tough because they move around quite a bit. So we got some good evaluation as a result of that. And that's one of the areas that I'm very committed to and I'm very interested in. I think my value proposition for me in the population that I work with is really increasing access to care to the underserved, underinsured, and the disenfranchised population. Thank you.
Thank you.
Good morning. My name is Liliana Soryo. I'm the Border Region Administrator for the Manager for the California-Mexico Health Initiative, now with a new name, the Health Initiative of the Americas. And what I do best, or my value proposition, I think is that the commitment that I have and my passion to really improve the health of the Latino community living here. So I do whatever is needed just to achieve the goal.
Excellent. Thank you.
Good morning. Mi nombre es Janet Garcia. Vengo de la Universidad.
I am here from the University of Puebla. I work in health communication. Now, my value proposition, I think, would be my experience in strategy as far as implementing health programs and sharing information on public health. Thank you.
Good morning. My name is Victoriano Diaz, and I work for Family Health Centers of San Diego as their programs manager of social marketing services. And what I guess my value position is that what we do is we create social marketing campaigns that are culturally sensitive to high-risk populations, including substance abuse users, the MSM or men who have sex with men populations here in San Diego, and other high-risk groups, and on a variety of health issues that include HIV prevention, access to care and treatment, hepatitis A, B, and C, as well as methamphetamine use and treatment and syphilis. So I guess what I'm kind of bringing is just kind of that link between community-based organizations and high-risk populations and creating social marketing campaigns that speak to them and that are culturally sensitive to their individualized needs.
Good morning. My name's Julie Minardi. I work for the Council of Community Clinics. They are Project SMART, Social Marketing as a Resource Tool. It's funded by the Center for Disease Control. We're in our 4th year of funding. What I bring to the table is, since we travel across the country and I have to evaluate the community, so I have to really force that community to look at its needs and to focus on one goal for their social marketing campaign. As you know, a lot of them want to come to the table with numerous goals. So I really focus on what is important for that community and what is realistic.
Good morning. Sorry, is this on? There we go. My name is Susan Kirby. I own a small social marketing consulting firm based in Solana Beach, California, which is just north of San Diego. And my value proposition has changed and shifted somewhat over the years. It was quite delightful to hear so many people in agencies with social marketing positions. When I started at CDC a long, long time ago, my value proposition was to bring marketing capacity to public health programs. And since leaving CDC about 5 or 6 years ago, my value proposition has been to bring more marketing thinking to my clients. So a lot of what I do is advocate for the audience's input into what clients are planning for their programs. So do a lot of audience research, but making sure, kind of holding their feet to the fire as an American expression of making sure the audience is listened to when it comes time to plan a program. Thank you.
All right, thank you very much. And I hope those of you in the back were thinking of your value proposition and what you bring to the table. It's a useful exercise to do. And again, I trust it'll help bring people together and that you're thinking, hey, I want to tap into that person, and you'll make the connections. We're going to move now from that personalization of value propositions to applying it in your professional setting to your organization, your department, your programs, and so on. When you were listening to people's value propositions, and there was a wide range of them, very interesting and diverse skills, I hope you heard the emphasis on benefits. In our field, we have this disease of talking about ourselves. It's kind of like the About Us page on websites that's sometimes bigger than everything else. And to most visitors, they don't care about you. They care about me, what's in it for me. So a value proposition leads you to focus on benefits and results. As an example of focusing on benefits, we'll draw from an end-of-life company. If they can do it to sell caskets, we can sure do it to promote health. Now, if you look at this, and this is taken from one of those giveaways that we get in the mail, there's about a dozen or 2 dozen coupons. It doesn't talk about what percent of what kind of wood a casket was made of. It doesn't talk about the features, the descriptions. It talks about the benefits. Caskets and urns for less, save money. Why pay high mortuary prices? In black on the right, don't burden your family. That's a psychological benefit. Good news, 50 to 65% off. If you look at the picture, it looks like the woman is saying to her husband, honey, good news, I bought your casket and I saved $500. Again, if they can focus on benefits in this context, we sure can do it. If McDonald's can bring us to tears about a $2 hamburger, we should be able to do it when we're talking about saving lives. But that means getting away from the technically accurate description of features only and go to the benefits, the value that people get from this. To put this in bigger context, the notion of looking at things from the audience's perspective and going with their perceived value, if this slide represents someone's mind, the mind of our target audience, and we're doing a smoking cessation program, because we work at this, we're passionate about it, we devote 8 hours, 10 hours a day to this, we think this is big. This is how much real estate our health issue occupies in people's minds and hearts. And the rest of life is little. Entertainment, music, food, money, well, that's small by comparison because we're doing health promotion. In contrast, the reality is a little bit different. One more. This rest of life is big, and our program, one more click, is kind of little, if that big. This is more reality. The key is leverage what happens in the rest of the world in popular culture, tie our program into things people care about, into saving money, into entertainment, and so on, and leverage what goes on in the rest of their lives. So one question you can ask yourself is, what is going on in your target audience's world that you can leverage? It may have nothing to do with health, but if you can make a connection, then you're tying into their values and their value proposition. The other issue has to do with where you live in people's minds and hearts, sometimes referred to as positioning. Go ahead. So think about this. Where are you now? How would you articulate where you want to be in people's heads? By default, you live somewhere. Kind of like B.F. Skinner talked about behavior modification. It happens anyway, so you might as well do it well. Positioning happens anyway, you might as well do it well. So where do you want to live? What do you want to be associated with? Can think of it as if you're in a bookstore. Are you in the self-help section? Are you in the psychology section? Are you in the business section? We organize our world in different ways and create these little compartments, these little niches. What niche do you occupy? One more. And where do you want to be? So this becomes a diagnostic to take you from where you are to where you want to be. And that's a fundamental tool to make things happen and advance your programs and fundamentally fulfill the needs and wants of your target audience. Okay, I'm going to move now to a couple examples, drawing on work we've done over the years, some affiliated with San Diego State School of Public Health, some with my consulting practice with AARP, with CDC, with lots of community-based organizations, and I'll highlight a few examples in particular. This one was a project we did, and if you didn't see the bottom line, you might not know it was about cancer, yes? So, Secrets of a Good Life. This was a project funded to Dr. John Elder. I was a co-investigator with him several years ago by the National Cancer Institute, and the idea was to see what worked better. If we give people straight off the shelf nutrition materials, if we give them tailored materials personalized to them, or if we have a promotora go in and meet with them. Bottom line, initially the tailored materials did real well. At the end it was beat out by the promotora condition in terms of effectiveness and cost effectiveness. But there is value in each approach. Now the point I'm making here has to do with positioning. Why did we call this Secrets of a Good Life? We could have said, this is your cancer risk reduction project. We could have said, this is your nutrition education project. Only problem is, no one would have cared. Or the people we really want to reach, this was targeting a lower SES, lower income Latino population in the South Bay. We wouldn't have got the participation we otherwise garnered. So our formative research, giving the audience a voice, told us we can elevate this in importance. We can ratchet it up their totem pole of priorities, get it nearer to the top. What's meaningful to them? A good life. So this is Secrets of a Good Life. And it also ties into the idea of novellas and stories that work so well with this population. So a lot of the intervention was created within the context of a photonovella. So the delivery tied into the value proposition, not just get healthy, not just reduce your risk, but Secrets of a Good Life. It puts it in a different place in people's minds and hearts. Okay, another example from the same project, we focus on the values that are important to them. Save time, taste better, save money. Some of these are explicitly about health, but others are about other benefits. So again, knowing the value proposition means knowing the target audience, looking from the outside in, what matters to them, and all the communications and all the intervention was directed at delivering these benefits. And finally, taking the broader context, similar to the slides showing TV shows, money, food, and so forth, this intervention was designed to tie into these things that went beyond health that were important to their lives. So people would consume, so to speak, the intervention, they'd read this stuff, they'd work with the promotoras because it was important to stress management, because it tied into their hobby of gardening, because it helped them with beauty and weight loss and so forth. So again, it's tying into the deeper values. Some of you may consider them more superficial values, but it's the values that drive what people do. Okay, moving on to another project. This is one that our colleague Fernando Flores was working on at the Vista Community Clinic and headed up by Dr. Ana Martinez Donati at San Diego State, a great project. And we decided in public health, we don't have enough acronyms. We need a new acronym. So on your sheet, this is the NGIL-MSM, the non-gay identified Latino men having sex with men, a very segmented audience, lived in North County, left-handed, like I'm just kidding about that. But it was a very segmented audience. And the idea here was, how do we figure out how to get these men who engage in sex with other men but don't consider themselves gay, how do we get them to acknowledge what they're doing is risky enough to get them to use condoms? And bottom line, the preliminary results that I've seen are showing a significant reduction in the number of partners people have with which they do not use condoms. So that suggests this is working. There were a couple big issues that came up. One is, the most important and relevant to this is, it's a secret. And these men would say things like, I'm a regular guy. And there was machismo that went with it. And I'm not gay. And it just happens that I have sex with men once in a while, but I'm not gay. It's just something I do. And it's a secret. I can't let people know. I'm not comfortable with homosexual behavior, and so on. So the masculine appearance was important. The desire to maintain secrecy was important. And there were some highly coveted values of family and work and values that we all care about. So we came up with a couple communications, and I was involved in the early stages of formative research, and there was a very talented team that implemented this. So this was one idea that tapped into cultural pride and played very well, and there were radio spots that went with it that some thought were quite hysterical. And we had to walk the line of, are we going to be offensive to men who are gay? And that was a fine line to walk, but we fundamentally focus on our target population is most important. Another more connected with the idea of secrets is this. I don't know if you can see this well. It's a shadow of two men, and the whole feel of this, it's secretive. And our message was not what you're doing is bad, not we're going to blow your secret, but in contrast, this will help you keep your secret. So we directed condom use directly into their main concern, which is keeping this a secret. So this is an illustration of a principle. If you can fix it, feature it, don't hide it, lead with it. If the thing is, it's a secret, let's lead with it, put it on the table, and leverage that. That's a value they believe in. Okay, one more example. This is an organizational level example. A lot of you are in management positions with public health organizations. This is with the Washington State Department of Health. And they came to us saying, we're not sufficiently valued. When the state legislature makes their decisions about budget, they didn't exactly use these words, but this is what they meant. Roads and jails gets more money. We are underknown and undervalued. We need to strengthen our value proposition and speak in a way that people get and care about. And so there were three key ideas that emerged. And this is on the basis of a lot of research with a lot of people within the organization. There are various constituents, the general public, the public health partners. The three main ideas that jumped out were again, the values they provide, essential programs for improving health, we're the information providers, and it works, and we protect your family. And the protecting your family was the heart one. That was one with passion. How can anyone not care about that? And this was consistent with work we did earlier with CDC. Susan Kirby was there at the time managing the project that emphasized fundamentally these same values as important. This is what matters about public health. This is what we deliver. The way they articulated those three ideas is here as follows in the orange section. So this is a way of putting it into words. There were other communication lessons we learned along the way, and that is a lot of people didn't get what they were saying. For example, they would say, we conduct community health assessments. People didn't know what that meant. They nod their head and smile, but they didn't really get it. After getting some feedback, they changed that to say, we monitor health in the community. Plain language conveys the benefit, the value in a way that matters. Second example, they said epidemiology and disease trends. We changed it to tracking health and disease. Plain language, again, it conveys the value, gets inside people's hearts. And finally, the one most relevant, health promotion, they would say improving the health status of the community. Anybody here ever say that? Okay, if you have, keep your hands down. All right, it's unanimous, that's everybody. So instead, a better way to say that was, we make a safer and healthier community. And notice which one resonates with you more as well. So very quickly, we took this to a deeper level and had a strategic framework. You can keep clicking through this. Where and this is a tool that's in the back of your handouts. We list the key constituencies and the main benefit to them on the left, come up with the themes like protecting you and your family, information that works, and so on, and then tailor the themes. So this is an hour in and of itself. I just want to briefly introduce this as a strategic tool to pull things together and to create what we call an identity platform. And very briefly, here's what it looks like when it's complete. So you have the target audience. The main benefit to the general public is you're safer and healthier. In contrast, the main benefit of public health to the business community is we are investments that work in your community, and so on. And then we tailor each of these key themes to each target audience, and this becomes a touchstone that guides all their communications. This becomes the benchmark for making programmatic decisions as well as communication decisions. Are we delivering on these three values that fundamentally end up producing better health? So a safer and healthier Washington. That was how they summarized things, always working for a safer and healthier Washington. So I ask you, what are you always working towards? How can you summarize what you do in terms of appealing to core values? That's how you create your value proposition. Okay, so we have a few more minutes. So one more click. So we'll do this. I want to summarize a few key lessons that'll help move into doing this. One is the faces of public health. I mentioned before, the main face of public health, and particularly prevention, is it's invisible and it works best. So how can you make things more visible at every point of contact, get the credit you are due? So convey the value and get the credit that you're worthy of deserving. So when people wash their hands, do they know that's the health department? When people get condoms, do they know it's your program? So how do you brand every point of contact in a way that conveys your value so people understand this organization, this program does a lot of good? They help me, they help my family, they help my community. Second is the notion of perceptions of prevention. Whether it's prevention, wellness, whatever we call it, that usually goes in people's heads. And again, they nod their heads and smile. But it's when we talk about protecting people, when we move it into the domain that has to do with safety and feeling secure, that's what resonates. So the value of prevention can be recast in terms of not just keeping us healthier, but keeping us safer and protecting us, and that seems to be more strongly received and more salient with most of the people we're trying to reach. I would contend that's true for migrant populations, certainly, with a variety of concerns about safety as it is for the general public. So think about how you can leverage this idea of protecting and being safer, providing those benefits. Third is the difference between wants and needs. We tend to focus on needs. We're epidemiologically driven. Think about wants. What drives your behavior, what you need or what you want? I would guess what you want. Most of us make more emotion-based decisions on what we want. So in your research, you find out what people want, and can you find a common ground between the needs of your program and the wants of people? But fundamentally, it's the wants that drive people's behavior. And finally, the emphasis again on the combination of safer and healthier. We tend to focus on a value proposition that delivers better health, and that's good, especially if people are hurting and are sick. But in the domain of prevention, if people aren't hurting, there's not a felt absence of health. So we need to make it more salient, and again, build in the safety, safer and healthier. So let's try it. We'll move to these tools, and you can think about it. You can jot things down. These are in your handouts. This is a worksheet, a starting point. So if you like, take just 2 minutes. And if you're thinking, well, this looks so pretty, I don't want to ruin it, what if I make a mistake? We'll get you more. There's more copies here, and I can email to Victoria, who can send along to who's ever interested. So I encourage you to take a moment and apply this, write it down. So list just 2 constituencies. One might be, for example, migrant farm workers. One might be gatekeepers to reach them. One might be funders. So just think of 2 different constituencies and write down what you think they value. So this is from your inside-in perspective. And then jot down what they say they value. This is presuming you've given them a voice and you've heard their perspective. If not, just guess. But that's a caveat, is you're guessing, and afterwards you should certainly go out and get real feedback, get real information to fill this in. So take just a moment and play with this experiment. And again, a reminder, focus on results and benefits, not descriptions of your programs. Focus on results. What do people get that they value? Think of a range of benefits. It helps people keep their secrets. It helps people lose weight. It helps people feel safer, whatever the case may be. Benefits. Okay, just another moment for this part. And we'll be doing in 5 minutes what would normally take a couple hours, a few weeks, if you get feedback from your target audiences and so on. So this is an exercise to play with the tools. Okay. So wherever you're at, let's move on to the next tool. And this means synthesizing what you know. It's what you jotted down on the first page, whatever else you have in your vast store of knowledge from all your work in social marketing, in health promotion, in public health. And so what are 2 or 3 things that you do that really provides value? This is a tool to create your value proposition. Think back to the Washington Department of Health. For them, it was providing information that works, protecting you and your family every day, and creating essential programs for improving health. The idea of essential was key there. So yours may be similar, they may be parallel. You can focus on the migrant population. So come up with 2 or 3 key themes that are overarching that you can come back to again and again that say, here's what we do that's valuable. Okay, now take a moment and go to the next sheet. In 1 sentence. God forbid we only have 1 sentence to describe our wonderful programs. But sometimes that's all we have. So this is a shorter version of the elevator speech. In 1 sentence, can you communicate the value? So get away from a lot of big words, get away from descriptive features, the value. So a way to test this is ask yourself the question, picture your target population, and say, why should they care about what we do? Bottom line, why should they care? What's in it for them? This sentence should answer that. Okay, I want to respect our time. We just have a couple more minutes. Is there anyone who'd like to share their two or three ideas in one sentence? Any brave soul willing to do that? Come on. Thank you very much, our first volunteer. Tell us your three key ideas in your one sentence.
Three key ideas was knowledge, sense of power, empowerment, skills, money, and increased awareness.
Okay, and briefly remind us of your program.
I wasn't here early enough to introduce myself, but I do research in Tijuana as well as Tamaulipas, the state of Tamaulipas, and we work with sex workers and intravenous drug users. And it's a research project, so we're assessing the risks that they have. Okay. So the three ideas are knowledge, sense of empowerment, skills would be the top three.
So that's what they get. Those are the benefits they receive.
Yes.
Okay, and how did you phrase that?
I said, you have the power to protect yourself and your family from disease.
Okay. So the benefit to them is they're protecting themselves and their family as well.
Through knowledge, skills, and the sense of empowerment.
Okay. So they won't get sick, and that prevents a whole slew of problems. Thank you very much. And so you need to decide where in the chain of outcomes, where you land. So this was about protecting your family from disease, and that's fine. That's a benefit. As long as that's valued by your target audience and they say, yes, tell me more, then it works. If not, then you go deeper and say, it'll save your kids from being in the hospital, save us from being out on the street, whatever point in the continuum of effects is most relevant, that's where you cast your value proposition. So I hope this was useful to you to come up with these examples, and I hope you'll work at it more. Again, you did in 5 minutes what takes hours and has lots of input from different people, but it's incredibly valuable to have this clear, and lots of organizations have come back to this again and again. If you go to the next slide. When they can put this into a strategic framework, like I showed you with Washington DOH, that summarizes what are our main benefits, why does each matter to each constituency, that can guide programmatic decisions, people decisions, policy decisions, and so on. So I encourage you to keep working on this, and I invite you to contact me personally. My contact information, I have some cards here. My contact information is on the handouts, and I promise I will get back to you. If you have ideas you want to share, if you want feedback on your value proposition drafts, let me know. I'll get back to you directly. So to wrap up, bottom line, if we do this well, it lets us live our greatness. My belief is, in this field, we all have greatness within us. It means being focused, doing what we do best, being clear about the value we deliver, and delivering on our promise. That is living greatness. And if we can't do it in this field, then no one can. We have so much potential. I appreciate your being here, and I encourage you to take this home. Check out your assumptions about the things your target audience values. Formalize your value proposition, and most importantly, you got to live it. It's not just words, it's what you live. And you deliver on it every day through your actions, through your programs, through your communications. And you work in concert with your value, deliver on your promise, and bottom line, it's making a safer and healthier world. That's why we're here. Thank you very much.